Beauticians without medical training shouldn't be allowed to give non-surgical treatments like Botox. It's according to the Royal College of Surgeons. There should be a ban on so-called Botox parties, and only trained doctors, nurses or dentists should be allowed to provide similar cosmetic treatments. Here's our health correspondent, Dominic Hughes.
OK, Danielle, I'm going to...
This is how the Royal College of Surgeons would like cosmetic procedures such as Botox to be carried out by a qualified and properly trained nurse. But there is a recognition that all too often these treatments are given in very different circumstances.
Now relax, OK. I think people don't view it as a serious matter, and they need to. You know, there can be a lot of damage done to people if they're not qualified and getting the right treatment in the right premises, really. So I think that's the biggest issue. I think vulnerable people are being taken advantage of.
Hundreds of thousands of non-surgical cosmetic treatments like this one are carried out in the UK each year, but we don't know exactly how many because the industry is at present unregulated. The Royal College of Surgeons says anyone, anywhere can carry out these kind of medical treatments without the proper training. So the Royal College of Surgeons is launching new guidelines for non-surgical cosmetic procedures. Patients should be given better information on the risks involved. They should be assessed to see if they need psychological support. And their expectations of what the procedure can achieve must be realistic.
I think it's very important in the consenting process between the person who's going to give the therapy and the patient that the patient understands what can be achieved and also is fully aware of the qualifications of the surgeon, nurse or dentist who's going to perform the procedure.
There's been a huge growth in non-surgical cosmetic treatments in recent years, but some are still reluctant to undergo the procedure in a salon rather than with trained medical staff.
Your local salon, they do your hair and nails and stuff like that. It's not supposed to be for major things like that.
I would probably feel comfortable because I don't see Botox so much as plastic surgery, but more like injections.
The Royal College is not a regulator, so can't enforce the guidelines, but it hopes they will feed into a review of cosmetic surgery that is due to report in March. Dominic Hughes, BBC News.
Well, joining me here, Anthony Armstrong, consultant plastic surgeon and tutor at the Royal College of Surgeons, and model and TV personality Alicia Duval, who's spoken publicly about her many cosmetic procedures. And Alicia, broadly, do you think you've had a good experience with what you've done, or have you been disappointed?
In general, absolutely disappointed. I've had a horrific experience, I'd say.
Go on.
When I started surgery when I was 17, I lied to the surgeon and said I was 18, and I had a first breast operation then. Yeah. And then after that I was convinced by the same surgeon into having my nose done, my eyes done.
When you say convinced, he suggested or she suggested these things to you?
Yeah, he suggested to me I would be better with a smaller nose and my face more in proportion, and if I had this done then I'd look a lot better.
And what was your response to that? Did you welcome that help, or did you feel pressurised, or?
Well, as a young girl, and even now, I still can't believe that these people that we see as doctors, that, you know, to me, he's a doctor, he's a professional, he's not going to lie, and he's not a salesman. He's a doctor. What he says must be true. Even
though you know you're not going to him because you're ill. I mean, clearly, you didn't go to him because you weren't well, right?
Yeah, but you don't expect a surgeon to lie or to be selling you stuff you don't need.
Anthony Armstrong, how realistic is it if somebody comes to you, and one of the recommendations in this is that you shouldn't give value judgments. You shouldn't say you look more beautiful or prettier or whatever. How realistic is that for a surgeon? I mean, if somebody comes to you with a big nose and says, will I look better if you do a nose job on me? You're going to say yes, aren't you?
Well, no, I think, Emily, sometimes we confuse cosmetic surgery and plastic surgery because the report that's been issued today is from the Royal College of Surgeons, and the Plastic Surgery Association have fed into that. And I think there's a fundamental interface between cosmetic surgery and plastic surgery. When I see a patient in my clinic, what I'm trying to do is analyse what the problem is in a scientific way and ask the patient what it is that they feel they want to have addressed. And I've got to say, many patients who come to see me and other plastic surgeons in the UK come initially because of one problem that they may feel that whether it's their nose or breast or tummy or whatever.
And then they get the the bug?
I've got to say, it's unusual in my experience that people get the bug and come back for 1 or 2 or 3 or 4 things. I mean, it is unusual, I've got to say.
Would you respond to Alicia's experience that she was faced with somebody who encouraged you into more?
Well, I mean, I can't obviously comment. We only met 10 minutes ago in your green room. But what I would say is this, that I think definitely there is a relationship between the doctor and the patient. And, you know, patients do come and they expect an honest opinion. And one of the most fundamental parts of cosmetic surgery is not the operation, it's the consultation beforehand. And I think you need to have an open, fair discussion with the patient. I turn patients away for cosmetic surgery. I mean, you know, patients sometimes come and say, I would like this done. I say, well, actually, I can't see there's a problem. I don't think it's in your best interest to be operated on, and surgery has risks.
You did raise your youth, and you admitted that you lied. I mean, I guess that was one of the things that they try and protect vulnerable people. But I guess you could have said no, right?
I was still 18,
nothing...
though. I mean, at the end of the day, I was still, you know, a teenager, still a child.
But what was it that made you listen? What was it that didn't, you know, make you say, I don't want to do it anymore, I'm going to leave here?
I think it just got worse and worse and worse, and I'd had, you know, operation after operation and more and more and more damage, and I got to that point where I just thought, it doesn't matter anymore.
Was it the quality of the operation that you were upset with, or was it, as you were explaining, the sort of pressure of you know, the continued...
I think plastic surgeons have turned so much into car salesmen now that I just saw through it. As I got older, I saw through all the rubbish that they'd sell you, and then I just realised, I woke up one day and I thought, I'm paying for your child's school fees and your nice retirement and I'm not doing it anymore. If I look like the back end of a bus, fine, but I know who the winner is here, it's you, not me.
I mean, it is odd, isn't it? I mean, for Anthony Armstrong, for a surgeon who's gone through this rigorous training in, you know, medicine and saving lives and all the rest of it, to say, right, put that on one side. I mean, you can justify doing these procedures, but...
Well, I think the justification, if there is any justification, comes in that, you know, part of my practice is NHS at 2 big trusts in Berkshire and Surrey. And the skills that I have in cosmetic surgery, I use to reconstruct patients. I've had calls today to go and see patients in the intensive care unit at a major trust. Now, although they're not having cosmetic surgery, the principles are the same. So I think what we have to do here is we have to actually say, it is timely that we have a report.
OK, but just very briefly, just respond to that question, which is, you know, people are sitting here feeling vulnerable, maybe 18 years old, and somebody's saying, oh, I think I could get another 3 terms of schooling out of a nip and tuck.
I think, Emily, that just debases it, really. I mean, at the end of the day, surgeons should act ethically and in the best interest of their patients. It's about professionalism and patient safety.
All right, thank you both very much indeed. Thanks for coming in.